Hi everyone, my name is Dr. Richard Horowitz. It's a pleasure being with you today. I'm here to talk to you about a Omega workshop that we're going to be doing called Living Well with Lyme Disease, which will be at the Omega Institute on June 20th to 22nd, 2014. I will be there with Dr. Tom Franciscott, who's a naturopathic doctor, as well as Katina Makris, who wrote the book Out of the Woods. And we will be doing a workshop like nothing you've seen before for Lyme disease, where this will be more of a healing experience. We'll be teaching doctors and health professionals about all the new updated work on Lyme disease, but also this will be experiential for patients, that if you've suffered from Lyme and want to empower yourself with information and healing, this is what we're going to be focusing on for this weekend. Many of you know that Lyme disease is not well recognized in the United States. Many doctors would say this to a patient: the bad news is you have Lyme disease. The good news is I don't believe in that disease, so you're fine. The problem we face at this point with Lyme and chronic disease in the United States is that, according to the CDC, chronic disease accounts for 70% of the deaths and 75% of the healthcare costs in the United States. We know that Lyme disease is the #1 spreading vector-borne epidemic worldwide, and it's mimicking many chronic diseases that many of you come to me with, like chronic fatigue, fibromyalgia, MS, autoimmune diseases. It's accounting for an increased burden of those suffering with chronic illness in the United States, and a lot of people are confused regarding the diagnosis and treatment of Lyme due to two standards of care in the United States. So at this conference, we're going to be discussing all of this: the two standards of care, how do you actually define Lyme disease, what is the difference between the surveillance definition and what we see in real life in a doctor's office, and I'm going to show you the definition of Lyme that I use called Lyme MSIDS, which stands for Multiple Systemic Infectious Disease Syndrome. We'll also be discussing at this conference diagnosing Lyme, the problems with serology and people who don't test positive on the classical tests. If we treat chronic Lyme disease, is there evidence of chronic persistence? Well, yes, there is, and we'll show you some of the classical and integrative protocols you can use to get better. We'll talk about chronic infection from not just Lyme, but also associated tick-borne infections that cause inflammation in the body. And inflammation, you may not know, is the #1 common denominator for all chronic disease. So even if you're not sick and you want to learn how to prevent chronic disease, you need to decrease inflammation in the body, and the MSIDS map that I'll be discussing at Omega will describe this in detail. We'll be focusing on diagnosing and treating what are called the 3 I's: chronic infection, inflammation, and immune dysfunction, and how I help people recover their health. And again, we'll be talking about this multifactorial model for chronic disease, and I will show you how multiple factors on the MSIDS map can be addressed to decrease inflammation and reduce some of your disabling symptoms. People who come to me have a clinical presentation that is classic for Lyme when they tell me the symptoms come and go, they have good and bad days, their pain migrates around the body, whether that is muscle pain, joint pain, nerve pain. One day it's in my shoulder, 2 days later it's in my elbow, 3 days later it's in my knee. Lyme is the only disease that causes this. Normally patients will tell me that they flare up right before, during, or after their menstrual cycle, and that if they take antibiotics, it makes their symptoms better or worse, which could be a Herxheimer reaction. The pain that they have may be resistant to standard treatment modalities. So we're going to show you at this conference how to use the Lyme MSIDS map to look through all of your symptoms to get help. So if you want to get off the Lyme hell ride and you want to have some fun and have a healing experience, I invite you then to spend time with us at Omega for Living Well with Lyme disease. Lyme disease and associated tick-borne infections are spreading worldwide in epidemic proportions. They're mimicking many chronic diseases that you've been diagnosed with or your friends and family have been diagnosed with. So come with an open mind and an open heart, and let's explore together how to live well with Lyme disease and find the spiritual messages in the illness that help move us forward on all of our healing journeys. Thank you for taking this time.